This is going into me. What am I doing? When Apple comes out with an AI doctor this year, I want to be ready to give it all of my data. And that means tracking my blood in real time with this. Okay, here goes nothing. Oh, that didn't hurt. I thought that was gonna hurt. Okay, I'm now attached to this for 2 weeks. Yes, one more thing to track me. Oh, I've never attached technology to me like this before, but hey, first time for everything. This disc is called the Lingo to help me better track the effects of what I eat and how it impacts my metabolism and energy and focus, and I'll get more into it in a moment, but it's one of the many health devices and sensors that anyone can buy now that send data to a phone, and it all can be synced with the Apple Health app, letting you analyze or share records with a doctor. And now that includes an AI doctor. OpenAI launched ChatGPT Health to pull in your health records from app data, and it can give you advice. And Anthropic, it just launched Claude for healthcare. Now that's going to work in a similar way by linking the Apple Health app or Android Health Connect into Claude's app to get a summary of test results and detect patterns in your health metrics. And reports say Apple is working on doing this very thing too. Bloomberg reported that Apple's service might be called Apple Health Plus, and it could launch as an update with iOS 27 this year, and we should expect it to be a paid subscription service like Apple Fitness Plus. But an AI coach is only as useful as the data you feed it, so it's time for me to put more data into my phone. That is, if we can even trust an AI coach, because this month Google had to remove some AI health summaries for giving people wrong advice. Now, let's go to Apple. Its biggest product is always the iPhone. But this AI health coach, it feels bigger than hardware, because getting an AI doctor right might be Apple's most important product launch this year. So let's get into why it's time for Apple, and time for me too for that matter, to level up health tracking this year. When I was at the CES Tech Show this month, I came across a number of health tracking gadgets, and I wanted to test it all because I'm not as healthy as I used to be. I look back on my old videos and I can see that I gained weight and I don't fit into my old clothes, and for years I've just figured that I'm tired and different now because I'm a mom, I'm getting older, but you know what is a little scary? Realizing that I just don't feel healthy all the time and I can't eat anything I want to anymore. So the company Abbott came out with this glucose biosensor, and I attached that to my arm. It is not for diabetics on insulin, but it sends minute-by-minute glucose data to my phone so I can see what happens to my energy as I eat. And I wanted to do this to get some real data to start myself on a new health awareness path. But this data collection is just for the next 2 weeks or so, and I'm supposed to take this data to a doctor. I also learned about hormone trackers that work with the iPhone. You could do all of this at home. Eli Health makes these wands that you stick in your mouth to track cortisol stress with your saliva. And then you take your phone camera to scan the results and put that info in an app. And I'm gonna do this. I'm gonna do it for a few weeks to see what I learn. It's also launching sensors for tracking testosterone and progesterone. But you can go wild with sensors. There are sensors now you can even put in toilets to track your health when you urinate, and it also tracks other fluids. Everything is trackable at home. It's not cheap, but it is trackable. Now, I never make time for doctor checkups, and I'm not proud about that. I'm really overdue. But if you look at where we are going with this technology, AI is getting to a point that if you missed a doc appointment, maybe you'll get a nudge from your phone about things you should be checking out. That is, if it can actually do anything meaningful with all the data you're giving it. Apple Health already makes it easy to get a lot of data to your doctor. There are simple tools like smart scales to track your weight, and the Apple Watch, well, it can give you a sense of changes in your heart rate or temperature and sleep pattern changes. Even your hearing health can be measured by AirPods Pro, and then you can send your hearing test results to a doctor. So it's only logical for Apple to want to have something that could put all of these pieces together to help make sense out of all the health data we're collecting on ourselves. This Bloomberg report on Apple Health Plus, it's said to be an AI health coach that can give nutrition advice and medical suggestions. But it's only good if it actually gives trusted info with all of the data. You see, in January, Google removed some of its AI health summaries at the top of its search results after a Guardian investigation found Google was giving bogus info about liver function tests. When asked, what is the normal range for liver blood tests? The reporter found that Google was giving numbers that had no context or accounting for the sex, ethnicity, or age of patients, and relying on those summaries could lead to ill patients thinking that they had normal test results. So of course, Apple needs to avoid a mistake like this. The company cannot afford to launch a quack doctor Siri. For Apple, this is also a subscription play for growing its business, and subscriptions are big business for Apple. Services are Apple's second largest product behind the iPhone. All of those subscriptions for things like iCloud, all the services that have fees like Apple Pay, the fees from the App Store, the money made from Apple Care warranties, that all brought in more than $28 billion in revenue for Apple last quarter, and it keeps going up. So it is a crucial part of Apple's business growth, especially since services do not have costly hardware eating at profit margins. And Apple has made a big marketing push around how having Apple products just helps you live a healthier life. Now, Apple just released results of a 4-year study of Apple Watch users that showed people who worked out with their Apple Watch in January were more likely to stay active and keep exercising. And the Apple Watch does tie into programs like Fitness Plus. It's another subscription service that also has been growing. Apple keeps expanding it to more countries and languages, now in Spanish, German, and Japanese, although they are dubbed versions of the English recording. Apple knows it needs to keep adding new features to keep people hooked. But will personal health advice be good enough to hook people to add another subscription? To give you a sense of the cost, Apple Fitness Plus starts at around $10 a month, and the Apple One Premier service that bundles all of Apple's subscriptions starts at about $38 a month. Now, I have that one, the Apple One Premier, because I can share it with family, but I never use Apple Fitness. I will make a commitment on this show that I'll start now, if anything, to see if there's enough content to keep it interesting. But I also want to see what health data I can collect on myself in the time that this new operating system will roll out, which might possibly have a better AI Siri and a new AI health coach. Hopefully, the AI is substantial enough to be more than just a friendly voice, and it can process data for this middle-aged moment in my life and know that I'm looking for suggestions to be healthier that don't take too much time. And maybe I can give my doctors data that gets me answers faster with more efficient visits. I hope you subscribe and follow the show, because I'm going to chime in on how it's going through the year. And we're going to talk about what else we learn about Apple's new software as the rumors hit. And if you're on a health journey with new sensors or apps, do share in the comments. And me and this little new friend of mine will catch you next week for one more thing.